Hello, my name, as you know, is Erica Slusser, and this is my ethics presentation on the elderly patient's experience. Patient A is a 95-year-old female living in a prestigious personal care home. Personal care homes are regulated by the state, so they must follow certain guidelines and rules. Patient A's experience takes place over the course of a few days. Initially, she starts with mild and subtle symptoms. Even she thinks it's just a sinus infection. Then she has a fall. She starts having some difficulty walking, and she starts having difficulty with her hand-eye coordination. Her doctor can't see her for an acute visit, so he sends his nurse practitioner, who does her best but doesn't know the patient very well. She interviews the staff, she reviews records, and then she goes and does a medical evaluation of the unfamiliar patient. Patient A has subtle symptoms. They're new to her, and they're new to those who know her best, yet these symptoms are common for an average elderly patient. Therefore, it's difficult for an unfamiliar provider to pick up on them. Anyway, she was seen by a nurse practitioner, eventually sent to Hospital A, who sent her back, and then after suffering multiple falls, she finally was diagnosed and treated for a stroke at Hospital B. Autonomy, the first of our 4 principles. Autonomy is the right people have to make their own life decisions. In healthcare, it's even deeper than that. Autonomy is how individuals are viewed and treated within the healthcare system. The close relationship that patient A had with the staff really helped them see the issues changing with her. So therefore, they relentlessly advocated for her. Possibly a part of what Hospital A lacked. Additionally, the nurse practitioner made her best attempts to really get to know this patient. Even the ambulance, whose policy is generally to transport to the nearest hospital, respected patient A's autonomy by agreeing to take her to Hospital B, honoring her request. Autonomy at the end of the day is likely what saved this patient. Even when her symptoms were downplayed by her children, care providers, Hospital A, it was her closest care aides who knew her best that continued to see her concerns and advocate for her eventual treatment. Beneficence is the ethical principle of healthcare providers to show kindness and compassion. It is the act of supporting and benefiting the patient. The frontline care aides had established relationships with patient A. They see her, they talk with her, and they provide her care on a regular basis. Their ability to get to know her on an individual level is a great example of quality, person-centered care. This person-centered connection helped the care aides to notice the subtle changes in patient A so that they could advocate for her. When she was declining, they showed her beneficence by knowing she was thirsty and giving her extra drinks, by knowing she was weak and walking with her to the dining room, and by showing her special attention, patience, kindness, and support. Actions or practices of a healthcare provider are considered right as long as they're in the best interest of the patient and avoiding negative consequences. Non-Maleficence is at the center of healthcare ethics since the times of Hippocrates. Similar to beneficence, non-maleficence is the legal and ethical duty to do no harm. There was some questionable non-maleficence in patient A's experience. First, it took several neglects before Hospital B finally came to a diagnosis and treatment. Although the timing and details of the stroke can't surely be identified. Healthcare providers promise to do no harm, and surely no one deliberately caused harm. However, there was certainly a delay in care. Initially, due to rules and regulations, a costly hospital transfer was avoided. Cutting corners caused a misdiagnosis, missed again at Hospital A, and then finally caught and treated by Hospital B. Additionally, when solutions to ethical problems are not optimal, the staff may experience stress. Clearly stressed, it was the floor staff who ultimately pushed for patient A to receive the care she needed. In healthcare, justice is not as simple as just getting what's fair. Justice is perceptual. What a patient finds fair might be different from what their family or doctor views as fair. Communication, compassion, and empathy are necessary to honor patient justice on an individual basis. Patient A luckily had access to multiple hospitals as resources, which is good and equitable, and favored her in her results. Distributive justice refers to the allocation of healthcare resources throughout society. If access to equitable healthcare was unjust, which luckily it wasn't, patient A may have had different results. A fair distribution of benefits and burdens should promote and sustain a frail and elderly patient as much as possible. Having appropriate resources and practical support, as well as both care aides and care providers being recognized as valuable and having an important role, is critical for providing the highest quality care, especially in a delicate population such as geriatrics. This was exhibited by the unfamiliar nurse practitioner valuing the opinions of the floor staff and care aides. It was ultimately the relentless advocating of the care aides that got patient A hospital admission and the appropriate treatment for a potentially critical diagnosis of stroke. Unfortunately, patient A's story is not entirely uncommon. Too often for the elderly, acute changes such as falls or confusion are seen by emergency room personnel as common behaviors for the geriatric population, causing underlying issues to sometimes be overlooked. It is ethically critical for those close to this frail group to advocate. First, all staff members are important, and teamwork is incredibly valuable to patient-centered care and patient satisfaction. Understanding the importance of the entire care team and treating them all as the valuable assets they are is a lesson in justice and something I definitely have a strong awareness of. As a healthcare leader, I will continually advocate for equality among staff members, staff justice, and the immeasurable value of teamwork. In addition to staff justice, I hope to provide more than adequate staff diversity training, including geriatric population education, so that all groups of people who receive care at my organization can have their autonomy respected with awareness. When hiring, I will look specifically for those who are passionate and possess qualities of beneficence and good ethics, and there will be no tolerance for anything but. I hope to keep my team feeling positive when they come to work by promoting an environment of teamwork and equity. I hope that if my team feels valued, they will pay that forward and truly value our patients, which will result in greater patient satisfaction. Healthcare ethics is an incredibly precious part of the healthcare industry. In fact, without it, healthcare would be a very ugly place. Rules, regulations, policies, procedures, and great patient care and advocacy can be difficult to juggle at times. Nonetheless, keeping strong roots in a great organizational mission helps healthcare leaders to make fast and appropriate decisions for the greatest good.